I'm back at Jefferson Animal Hospital with Dr. Kennedy to talk about what's been a serious issue for dog owners, canine influenza. It's hit our community.
This is a very new disease for pets that we have not seen before. And it started in Chicago and Atlanta and Louisville, and we have been hit hard since June. It's only been since June. And this is not kennel cough. It will sometimes present a little bit like kennel cough, but the pets become lethargic. They don't eat. They can get fever. There have been some deaths reported. There is an excellent vaccine available, and we are telling people to be careful about going to boarding facilities, going to places where other dogs congregate, about going to any place that the parks with other dogs, but you need to get a vaccine. There's two versions of the virus, and the vaccine has to cover both. So it has to be what they call a bivalent vaccine. Now, the problem is if your dog gets exposed to it, they can be shedding the virus before they even show symptoms. And they can get sick, and then they can keep shedding the virus. So it's highly contagious. If they do get the vaccine, they get one now, and then one in 2 to 4 weeks later. But your pet is not protected until 2 weeks after the second vaccine. So you have to be careful and get these vaccines way ahead of time. It's quite excellent if you do get the vaccines, but if you're going to be boarding next week, you don't have time to get the vaccine. And you really, and all the boarding facilities now are recommending it.
Okay. And same with, dog parks, etc.
Right. You need to get the vaccine, and you need to get both of the vaccines. Now, what we've found is if somebody calls and they have a coughing pet, we don't want them in the hospital. It is so contagious, and it's an aerosol spread. So we are seeing any coughing patients in the back of our office. We have an exam table set up, and we have a special tent, and we are not hospitalizing them. We can teach the owner how to give sub-Q fluids and how to give antibiotics. And how to treat it symptomatically, but it's extremely contagious. So everybody needs to be aware. The more people that get the vaccine for their dogs, the sooner this disease is going to settle down and kind of disappear as an acute condition.
Okay, good information. Our UK loving buddy Max has had the vaccination. Coming up, we'll have more with Dr. Kennedy.